Clinical studies show that after menopause, estrogen loss causes the vaginal and vulvar tissue to become 20–30% thinner. That means the same soaps you've used for decades can now trigger burning, itching, and infections. But most women don't realize it. Today I'll explain the right way to care for this delicate area and the habits you need to stop immediately. I'm Dr. Eliza Hart, a gynecologist with more than 15 years of experience helping women navigate life after 40, especially through menopause and beyond. Every week I meet women who are frustrated and confused because no one ever explained to them how their hygiene needs change as they age. My goal is to give you the same clear, evidence-based guidance I share with my own patients. The truth is, most women are still washing in ways that strip away natural protection, making irritation and infections worse, not better. This video will walk you step by step through what science actually recommends, how to clean safely, what products to avoid, and when it's time to see a doctor. By the end, you'll know exactly how to protect your health and stay comfortable without the guesswork or the myths. And before we dive in, if women's health after 60 matters to you, make sure to subscribe and tap the notification bell so you don't miss any of my future tips. Please help me reach my first 1,000 subscribers so I can continue growing this channel and bringing you more evidence-based guidance. Also drop a 1 in the comments. If you find this topic helpful, it lets me know I'm creating the guidance you truly need. 1. Understanding the anatomy clearly. Most women change everything except the one thing that matters, knowing exactly which part of the body requires care. This misunderstanding is so common that it has quietly shaped the way entire generations clean themselves. I often meet women who still use the term vagina when they are actually talking about the vulva, and that mix-up is not a harmless slip of language. It directly influences how women wash, what products they buy, and whether their daily habits protect or damage their health. The vagina and the vulva are not the same. The vagina is an internal canal that connects the cervix to the outside world. You cannot see it in a mirror, and you do not need to wash it. From a medical perspective, the vagina is remarkable because it is self-regulating. Its lining produces secretions that naturally flush out bacteria, remove old cells, and maintain an acidic environment with a pH of around 3.8 to 4.5. That acidity allows protective lactobacillus to thrive and prevents harmful organisms from taking hold. When women interfere with this delicate balance by douching or rinsing inside, they wash away the very system that is designed to keep them healthy. Instead of preventing infection, they create the conditions for irritation and recurrent problems. The vulva, by contrast, is external and visible. It includes the outer lips, the inner lips, the clitoris and its hood, and the pubic mound where hair usually grows. Unlike the vagina, the vulva has no internal cleaning system. It is exposed daily to sweat oils, urine, and bacteria from surrounding skin. Because the vulva has folds and fragile tissue residue can accumulate easily, especially after menopause. This is the area that requires daily care, and it must be handled gently to avoid stripping away the little natural protection that remains. Over the years, I have listened to women describe cycles of dryness, itching, and soreness that persisted no matter how carefully they scrubbed. They believed that stronger products or more rigorous washing would bring relief, yet those habits were the very cause of their discomfort. Once I explained that the vagina should never be washed and that only the vulva needs mild cleansing, many felt both surprised and relieved. What they saw as a personal failing was in truth a widespread misunderstanding passed down for decades. Recognizing this distinction may seem small, but it changes everything. It frees women from unnecessary rituals, saves them from buying products that irritate more than they soothe, and offers a foundation for real comfort. It also guards against one of the most damaging myths in women's health, that odor is a sign of dirtiness. In reality, a mild natural scent is perfectly normal, while a strong or unusual odor should prompt a medical checkup, not the use of deodorizing sprays or perfumes. Once you understand the difference between what the vagina does on its own and what the vulva truly needs, you can let go of the confusion that has clouded women's health for far too long. With that clarity, you are ready to see why these distinctions matter even more after menopause, when hormonal changes make the tissues far less forgiving. 2. Why women over 60 need special care. By the time a woman reaches her 60s, her body is not simply older. It has gone through a profound hormonal transition that changes how the skin and tissues of the intimate area behave. Estrogen, the hormone that once kept the vulvar and vaginal tissue supple, elastic, and naturally lubricated, drops dramatically after menopause. This decline is not just a number on a lab result, it has visible and tangible consequences that affect daily comfort. When estrogen levels fall, the tissue of the vulva and surrounding areas becomes noticeably thinner. Clinical studies show that the epithelial layer may shrink by as much as 20 to 30%, which leaves the skin more fragile and more easily irritated. What this means in everyday life is that the same soap or cleansing habit you tolerated in your 40s can suddenly feel harsh and even painful at 65. I often hear patients say, "I've used this product for decades without a problem. Why is it bothering me now?" The answer is not that they suddenly became sensitive, but that their skin has changed and their old routine no longer matches their new reality. The decline in estrogen also reduces the production of natural oils and moisture. In earlier years, these secretions acted as a protective barrier, keeping irritation at bay and maintaining a smoother surface. After menopause, that barrier weakens, leaving the tissue exposed. Without those natural defenses, anything from fragrant soaps to overly hot water can strip what little lubrication is left, triggering itching, stinging, or a persistent sense of dryness. For some women, this dryness shows up not only during hygiene routines but also during daily activities, from walking to sitting, making quality of life noticeably worse. Another factor that becomes more significant after 60 is urinary leakage. Even small amounts of incontinence, a few drops here and there during the day, can cause big problems for fragile skin. Urine residue is irritating, and when it sits on thin vulvar tissue, it can cause burning odor and recurring infections. Understandably, many women respond by washing more often or more aggressively, thinking they are compensating for the leakage. Yet in reality, scrubbing harder or using stronger products only increases the irritation and sets up a cycle of more dryness and more discomfort. This is why postmenopausal hygiene is not about adding more steps, more soaps, or more products. It is about stripping away the unnecessary habits and focusing on what truly helps. Gentle care becomes the rule, not the exception. What worked at 40 does not automatically serve you at 70. Just as your skincare routine for your face changes with age, so too must your approach to vulvar care adapt to your hormonal stage of life. I remind my patients that this shift is not a loss of control, but an invitation to wisdom. You're not doing anything wrong. Your body is simply in a different chapter. Recognizing the changes brought on by estrogen loss allows you to adjust with knowledge rather than frustration. Once you accept this, you can begin to approach daily hygiene in a way that soothes rather than harms, protects rather than exposes. And when that mindset settles in, you are prepared to look at the practical steps that turn this knowledge into an everyday routine. 3. Daily hygiene checklist for the vulva. Once you recognize how menopause reshapes your intimate health, the next question is not why, but how. How do you take this knowledge and translate it into daily habits that truly protect your comfort? The good news is that the essentials are straightforward. You don't need expensive products, complicated routines, or a shelf lined with bottles. What you need is consistency, gentleness, and a few scientifically sound practices that work with your body rather than against it. The first step is water temperature. Always reach for warm water, not hot, not cold. Hot water may feel soothing for a moment, but it strips away the natural lipids that still play a vital role in your vulvar tissue. Over time, that dryness builds, leaving the skin more vulnerable. Lukewarm water cleans effectively without causing irritation, offering the right balance between comfort and protection. Next is the choice of cleanser. This is where so many women go wrong. Fragranced soaps may promise freshness, but what they deliver is irritation. The chemicals used to create those appealing scents are not designed for the thin, sensitive skin of the vulva. At this stage in life, the safest option is an unscented, mild cleanser with a pH close to that of healthy vulvar tissue, ideally between 4.0 and 5.5. Dermatologically tested products labeled for sensitive skin are generally a good fit. Technique matters just as much as product. Use your hands, not sponges or washcloths. I understand that some women feel a cloth makes them cleaner, but in reality it can be too abrasive and may even harbor bacteria. Clean hands are gentler and safer. With your fingers, gently separate the folds of the labia to wash both the outer and inner lips. Give attention to the clitoral area and the pubic mound, but remember, this is not about scrubbing. Think of it as rinsing away residue rather than scouring a surface. Rinsing thoroughly is essential. Residual cleanser can be as irritating as the wrong product itself, so take your time with this step. Once finished, dry the area by patting gently with a clean towel, never rub. Friction on fragile skin only leads to micro tears and soreness. Finally, choose breathable cotton underwear and change it daily. Always wash new garments before wearing them to remove manufacturing residues that may irritate the skin. At first glance, these steps may appear almost too simple, but their effectiveness lies precisely in what you avoid. No hot water, no fragrances, no rough tools, no unnecessary products. Gentle consistency builds resilience. The women who follow this approach often return to me weeks later and say, "I didn't realize it could feel this comfortable again." I'd love to hear from you as well. Have you already tried some of these changes, or are you learning them for the first time today? Share your experience in the comments, because your story may be exactly what another woman needs to hear. When we speak openly about these topics, we replace years of silence with support and clarity. With these daily practices established, the next challenge is knowing what not to do, the common habits that undo all your best efforts. And that is exactly what we will explore next. 4. The big don'ts, harmful habits. Even when women learn the basics of gentle cleansing, many still hold on to habits that quietly undo all the progress. These practices are often carried from earlier years, reinforced by advertisements or old advice, and rarely questioned. Yet they are the very reasons why irritation, dryness, and infections continue. Knowing what not to do is just as important as knowing what steps to take. One of the most damaging routines is douching. For decades, women were told that rinsing inside the vagina was the path to freshness, when in fact the opposite is true. Studies from the Centers for Disease Control and Prevention show that women who douche are significantly more likely to develop bacterial vaginosis yeast infections and even pelvic inflammatory disease. The reason is simple. The vagina already has a self-cleaning system. When you flush it out with solutions or scented liquids, you wash away the protective bacteria and alter the natural pH. Instead of cleanliness, you create imbalance. Another frequent mistake is the use of fragranced wipes and sprays. These products are often marketed as discreet or feminine, promising confidence in social situations. What they really deliver is chemical irritation. The delicate vulvar skin is not designed to tolerate perfumes, alcohols, or preservatives. Many of my patients have come to me with rashes, redness, or recurrent itching that traced back to nothing more than a habit of using wipes after the restroom. Once they stopped, the symptoms often improved within days. What felt like an extra layer of care was in fact the trigger for discomfort. Bathing practices can also be misleading. A long soak in the tub may feel relaxing for muscles and joints, but it does little for intimate hygiene. In fact, it can dry the skin further and allow residue to linger in the folds of the vulva. Likewise, directing a strong jet of water from the shower head against the vulva may seem thorough, but the pressure can injure fragile tissue and in rare cases push water where it does not belong. These habits are subtle but cumulative, wearing down comfort over time. Vaginal deodorants fall into the same category of well-intentioned but harmful products. They reinforce the damaging myth that a woman's natural scent is something to be covered. In reality, a mild odor is normal and healthy. If the smell is strong, fishy, or unusual, that is a sign of imbalance and a reason to seek medical advice, not to mask the problem with fragrance. Unfortunately, many women delay medical visits because they feel embarrassed, and in the meantime, the sprays they use only add more irritation. What unites all these habits is a belief that stronger, fresher, or more thorough means healthier. The truth is gentler and far simpler. Your body was designed with wisdom, and your role is to support, not override, its natural defenses. By letting go of douching fragrance products, long soaks, and harsh sprays, you protect the balance your body already maintains. Letting go of these myths and missteps is empowering. It allows you to step into a new stage of life with less confusion and more confidence. And once you stop doing the things that harm you, the next step is learning how to separate false myths from genuine medical signs so you know when to relax and when to take action. 5. Common myths that mislead women. Even after harmful habits are put aside, many women remain caught in the grip of myths that have been passed from one generation to the next. These beliefs often sound harmless, sometimes even reassuring, yet they quietly shape how women see their own bodies. Myths are powerful because they mix a grain of truth with cultural expectations, leaving women uncertain about what is natural and what is not. One of the most damaging myths is the idea that a healthy woman should smell like flowers. Advertising has repeated this message for decades, selling soaps, sprays, and wipes with the promise of confidence. But your body was never designed to smell like perfume. A mild natural scent is a sign of health, while an unpleasant or strong odor is a clinical sign that something needs attention. The belief that you must disguise your natural scent feeds shame and delays medical care, leaving many women struggling with preventable problems. Another myth is that long-term habits must be safe, simply because you have not noticed problems before. I often hear women say, "I've been using the same bar soap for 30 years. How can it suddenly be harmful?" The answer lies in the way the body changes after menopause. As estrogen declines, the skin of the vulva becomes thinner, less elastic, and less resistant to chemicals. A cleanser that was tolerated in your 40s may now be harsh in your 70s. What was once benign can gradually become a trigger for discomfort, and the transition can happen so quietly that you blame yourself rather than the product. There is also the misconception that a bath is enough to keep the vulva clean. A soak may feel soothing, but water alone does not remove sweat bacteria or residue from the folds of the vulva. Women who rely only on soaking often find that irritation persists despite their efforts. True hygiene requires targeted, gentle cleaning, not simply immersion. Perhaps the most subtle myth of all is the idea that more washing always means better protection. This belief drives women to scrub harder, to wash multiple times a day, or to reach for stronger cleansers when irritation arises. In reality, these actions worsen the very symptoms they are meant to relieve. The vulva is not a surface to be scoured. It is delicate tissue that needs preservation. Too much washing strips away oils, disrupts the pH, and invites infection. I encourage you to reflect on these myths and ask yourself which ones you may still hold. Do you feel uneasy if you notice your natural scent? Do you assume that what worked for you at 40 must still be right today? Do you believe that scrubbing harder is a sign of diligence? Recognizing these patterns is the first step to breaking them. I would love for you to share in the comments which of these myths surprised you most, or which ones you once believed. When women speak openly, they not only free themselves, but also encourage others to let go of shame and confusion. Your voice could be the reassurance another woman has been waiting for. And once these myths lose their power, the path becomes clearer. It's time to focus on realistic ways to adjust your routine, adopt gentler habits, and know which signals deserve professional attention. That is what we will explore next. Shifting your daily habits does not need to feel overwhelming. In fact, the most effective adjustments are often the smallest. If you have been using fragranced soaps for years, begin by alternating. Use your usual product one day and a fragrance-free cleanser the next. Within a week or two, transition fully to the gentler option. This gradual change allows your skin to adjust without the sudden shock of a complete switch. For women with very sensitive skin, starting with only warm water for the first week can be remarkably soothing. Once the irritation subsides, you can introduce a mild pH-balanced cleanser every few days. Over time, make it part of your routine, always remembering that less is more. Other small but powerful changes include using a separate soft cotton towel for intimate drying padding, rather than rubbing and choosing breathable underwear that is washed before its first use. If you experience minor leakage during the day, carrying a change of cotton underwear or using a simple liner and gently cleansing with warm water at home prevents residue from irritating the skin. Equally important is recognizing when self-care is no longer enough. If itching, burning, or dryness persist despite these changes, or if you notice unusual discharge pain during intimacy or any bleeding after menopause, it is time to see your doctor. These are not signs of poor hygiene, but clinical signals that deserve professional evaluation. By combining gentle daily routines with the wisdom to seek help when needed, you create a balanced approach that respects both your body and your peace of mind. Small, consistent choices lead to lasting comfort, and timely medical guidance ensures your health remains protected. As we close, let me bring all of this together. The most important lesson is that your vagina does not require washing or perfumes. It is a self-regulating organ designed with its own defenses. The vulva, however, benefits from gentle care, warm water, a mild cleanser, and the lightest touch. Anything beyond that only risks irritation. After menopause, when estrogen levels decline and tissue becomes more fragile, this simplicity is not optional. It is essential for maintaining comfort. The payoff of these changes is not just physical relief, but peace of mind. When you let go of myths, harmful products, and unnecessary routines, you give your body the chance to thrive in the way it was meant to. Dryness lessens, irritation eases, and the cycle of confusion and shame finally breaks. Most importantly, you regain confidence, the quiet assurance that you are taking care of yourself wisely. My advice is to start small, stay consistent, and pay attention to your body's signals. Do not ignore persistent discomfort and never feel embarrassed to seek medical help. Protecting your health is an act of strength, not weakness. If this video gave you clarity or comfort, please share it with another woman who may still be struggling with outdated advice. And I would truly love to hear your thoughts in the comments. What was most helpful, and what would you like me to cover next? Your voice helps shape this community, and your support helps me continue creating guidance tailored for women like you. Thank you for spending this time with me. Take these steps, honor your body, and remember it is never too late to feel healthy, comfortable, and confident again.